Hi, my name is Mary. I'm going to be your nurse today. How are you?
Good, thank you.
Can you tell me your name and date of birth?
Katie Powell, March 12th, 1984.
Okay, good. Well, I'm here because we're going to do a head-to-toe assessment on you, and it should be real quick. We won't have to expose anything, but I do need to have a video recorded. Is that okay if we video record you?
Yes.
Okay, good. Let me just wash my hands and put on gloves, and we'll get started. Washing my hands, putting on gloves. Alrighty, can you tell me what year it is?
2017.
Okay, do you know where you are right now?
Yes, I have.
Good. And, are you having any pain?
No, just hard to breathe.
Good, hard to breathe, okay. And you're admitted for pneumonia. Katie's been admitted for pneumonia, and she has a history of smoking. She's 33 years old. Okay, we're going to get started. Alright. Just check your head out, your oxygen out your nose. Sorry about that. Let's put that little sucker. Alright, skin is good, intact, moist on her face. Let's look in your eyes. Equal, brisk, reactive. How many fingers am I holding up?
2.
Good, good. Can you stick your tongue out? Can you smile for me? I did it with you. Can you turn your head from side to side? Good, good. Okay, now shrug your shoulders. Good, good. Okay. Turn your neck for me that way, or just look at your carotid artery. Good there. No JVD, no worries or anything heard. Okay, she's got 2 liters of oxygen on, and that seems to be fine. You're not having any shortness of breath. Chest is equal, rise and fall, no tachypnea noted. We're going to listen to her lungs. Deep breaths. Good. Can you just sit up or roll on your side, whatever's easier. Okay. Deep breath. Deep breath. Okay, that's good. She is a little diminished in the bases, otherwise her lungs are clear. Now listen to your heart. Okay, can you move your arms up for me? Good. Alright, can you squeeze my hands? Good. No issues there, no soreness or anything. Capillary refill is brisk and good. Skin turgor is good, moist, elastic. Any abdomen problems? No? No pain? Okay, we're just going to press on you a little bit. No mass is noted, no tenderness. She's got active bowel sounds times 4 quadrants. Have you had any trouble moving your bowels or using the bathroom or anything? No. Okay, good. Check her pulses. She's got a good brachial and a good radial pulse. And a good femoral. Legs are good. No issue there, no wounds or anything. Okay. Good pulses, 2/2. Capillary refill is good. Less than 3 seconds on her extremities. No wounds noted on her heels. Can you move your legs up for me? Okay, good. That's good. Down. Okay. Now pull back like you're pulling back. And then push forward like you're driving a car. There you go. Good. Good motor strength and equal in both extremities. And if you'll just roll over one more time, we'll check your skin on your back. No issues there. Okay, good. Roll back. Okay, because you're a smoker and you're so young and you've already gotten pneumonia, we really need to educate you on the importance of stopping smoking and how bad it is for your lungs over time. We have smoking cessation programs and pamphlets we can give you if you're interested. And then you also should probably follow up with a pneumonia shot before you leave the hospital. It's good for 5 years and it will protect you from getting pneumonia because you are at high risk now since you have had pneumonia and you're a smoker. Okay? Sound good?
Yeah, I need to quit. I've been wanting to quit.
Yeah, that's good. You really should try presentation today, Katie.
You're welcome.
Is there anything else I can do to make you more comfortable?
No, that's it.